I'm Jermaine, 36-year-old colon cancer survivor. You mind introducing yourself?
Sure. My name is Supriya Rao. I'm a board certified internal medicine, gastroenterology, and obesity medicine physician in the Boston area, and happy to be on to discuss nutrition during chemotherapy.
All right, and so the question, and this is the big question. I'm going through chemotherapy currently. I'm going through a 6-month regimen. The first one is okay, and to my understanding, they get worse and worse. And it's
What is your cycle? Like you have?
So what I'm doing is I'm doing full fox. I'm doing, I think every 2 weeks, I'll do the oxaliplatin, and I forgot the other one in-house. And then I'll do a pouch with a pump for 24 hours. For 48 hours.
Okay.
Well, floor seal.
Oh, okay. 5 of you. Got it.
And it's not the best. It's horrible. And so like this is my 3rd cycle that I've gone through. And for that whole week until that Tuesday, until that Monday, I just couldn't eat. I didn't want to eat anything. The nausea, the sick part wasn't there as much as was the desire to eat. I'd have a sandwich in front of me and I couldn't eat the whole sandwich. All I'd eat that day, I'd have to force myself to eat it.
Right.
So I think nutrition is one of my scares.
Yeah.
Before this, I used to cook a lot. I try to be as nutritious as possible. I worked out. Now, I don't count my calories as much. I don't count my macros, but I know that there's a deficit, and I've lost and gained weight pretty cyclic since I started chemo.
What is your, so how many weeks do you have off? And so your chemo is 1 week, and then how many weeks until your next cycle?
So I'll do chemo on a Tuesday. I have 2 weeks, and then I'll do chemo again.
I see.
And so this is technically my off week.
Right. So it comes pretty quickly. So what I suggest actually, and I've heard a lot of patients say this has been helpful, is on those off weeks to meal prep and have things ready, so that things that you like to eat, things that you feel like, and I know during chemo weeks, you probably don't feel like eating anything, but at least something which might appear appetizing to you is going to be your best bet. And during those 2 weeks, make sure that you're eating as healthy a diet as possible, getting as much nutrition, because you do need some extra calories and nutrition in order to go through chemo, in order for your body to withstand chemotherapy. So during those 2 off weeks, basically it's meal prep, get your groceries, enlist the help of friends and family to help get your food going. In terms of the nutrition that you should be doing during that time, it should be, healthy diet. So you're thinking lean proteins, if you eat meat, lean chicken, fish, those are kind of like a Mediterranean diet. Lots of fruits and vegetables to get your healthy vitamins and nutrients from. A very colorful vegetable kind of diet, greens, broccoli, cauliflower, pretty much all the vegetables. And then, kind of moderate or limited amounts of dairy, like if you like yogurt and things like that, that's obviously good. And then whole grain carbohydrates. So, instead of, if you eat a sandwich with white bread on it, obviously, whatever, right now it's okay. But like trying to stick to kind of more whole grains, brown rice, quinoa, those kinds of sprouted wheat, I feel like are just more complex. Sweet potatoes, even potatoes are okay. But just making sure that you try and stay with a healthy diet, because, during chemo, you're going to kind of be struggling a little bit. So trying to stay within the healthy diet during those 2 weeks.
And so there's a lot to digest. And I think one of the things I question, because I used to count calories, my maintenance calories, say that I weren't on chemo.
Right.
How would that change now that I'm on chemo? I used to do carb cycling and would do intermittent fasting. And so I usually adjust, like on the days that I did high intensity, I would increase my maintenance calories. I would go above that, and the ones that I didn't, I rested, I went below. So now, how would the calories?
I guess it just really depends on what you're trying to achieve, right? So like for a lot of people during chemo, especially if it's like a 6-month period, They're just trying to get through it, right? And so they're just basically trying to, increase your maintenance dose by like, based on what a nutritionist would say, like 15, 20, 30%, right? But at the same time, I wouldn't recommend doing intermittent fasting during this time. I just don't think it's the right time. I think
I'm not doing intermittent fasting. Well, I think I am actually.
Oh, well.
Those days I'm not eating. I mean,
Yeah.
it's not that I don't want to. It's just, and when I eat, it doesn't even feel right. I mean, my body doesn't feel right, and it's just
Right.
it's a horrible feeling. People would explain to me, and of course you can't explain it. I say, well, they say, well, you have this bad feeling. They say it's nausea, but you're not throwing up. I'm like, what is? And they was just, and I've had most people say it's just blah. You just feel blah, and I think that's what I'm experiencing is that blah.
I think speaking with your oncology team about ways to battle that. So let's say you have nausea. So being on different antiemetics to kind of help take that away. Obviously doesn't get rid of the blah feeling, but it does take the edge off for the nausea. If you have difficulty with just appetite, your appetite's really poor, there are medications out there that can act as an appetite stimulant. So talk to your physician about that. Medications like mirtazapine or Marinol, these medications can be helpful. So it's definitely an avenue to discuss. And then it's just based on individual. So for example, like if you're going through chemo and you end up getting sores in your mouth from the chemotherapy or whatever, obviously eating like a super hot soup is not going to be the best thing for you to be eating. You want to kind of tailor it to what your body is going through. So for example, you want to have instead like milkshakes or like something cool to kind of help alleviate the pain.
I'm on the oxyplate, so the cool is out of the window also.
Yeah, right, exactly. So it just has to be kind of, tailored to whatever you're going through.
And so for what you're saying 15 to 20% above whatever my maintenance is now.
Just to kind of give yourself that extra padding in a way to like be able to help battle going through chemo.
I've heard people, there's so many suggestions, and I think I take all of them in. I don't disregard anyone's ideas because I think they work. Sometimes they don't work for me, or they might not work for others, and they might work for me. But there's so many. Oh, you need sea moss, or you need like I'm doing microgreens, and I enjoy those. I've done video with them. A friend of mine, he's grown them for me.
Oh, great!
I put them on some potatoes a couple of weeks ago.
Yeah, they're wonderful. Microgreens are awesome.
What are some good foods that are essential for me now that you would suggest that, let's just say I can't eat a lot. What would help?
Oh, I see. Okay. So I think that one other thing is that we're used to kind of eating 3 meals a day in general as people. But I think if you're on chemo, I think eating 5 to 6 smaller meals, kind of scattered through the day is actually much more palatable for some people. And again, I think that what you're doing, microgreens are good. I honestly think, trying some plant-based protein, if you feel like some people get a meat aversion, they can't handle eating meat. So plant-based protein in the form of beans, legumes, lentils, that is actually like really great carbohydrate source, as well as a really good plant-based protein source.
Because it's complex and it's got fiber, so it's not.
So it's not just like a straight carb, but it's a complex carb, plus it has the protein piece to it too, which I think is really important.
So what about whey protein?
Yeah, whey protein.
I didn't like that.
I mean, again, each to their own. I don't think you necessarily need to do whey protein because I think you can get a lot of good protein just from your diet. I don't think it's necessary to have protein supplements.
Well, when I say whey protein is because I took it for years. I haven't taken
it. A lot of people have in the past.
But I haven't taken it in years, but I was able to, I'm able to make a shake or something like that with it. I mean, I guess it would be the equivalent of Ensure if I didn't have an appetite.
Right.
And so is it not a good alternative, or you think I should still try something?
It's not that it's not a good alternative. It's just that I don't think you need to use whey protein as a protein source, even if you're using it in a shake or something like that. Because I think if you're using a shake, you can use yogurt, you can use a nut butter, you can use different, there are other ways to get protein in that instead of doing a whey protein powder. But if you want to, it's not necessarily, you can do it. I just think that you can get it from foods as well.
I've made nut milk before. So, probably some walnuts or almond milk.
Yeah. Almonds. Yeah.
Okay. And so even if I made a smoothie, trying to supplement those instead of the whey protein would be.
Yeah, I think you'll find like throwing in a handful of nuts, you're going to get almost the same amount of protein, and it's an actual food.
Okay. What else do you think? I mean, any other superfoods? Because everyone wants that superfood. Like sea moss. Everyone talks about sea moss. What do you think?
Yeah, sea moss. I mean, I think you'd think about like foods high in antioxidants. I mean, if you're thinking about fruit like blueberries, mangoes, if you think about, good fats for you, avocados are considered a superfood. I think, Greek yogurt is considered a superfood. Pretty much all the non-starchy vegetables, I think leafy greens are amazing. They're a great source of antioxidants and vitamins and minerals. So basically, if you're sticking to a Mediterranean diet, and like if you eat fish, fatty fish, or like salmon or something like that has been known or been helpful as well. So those are the things I would think about.
But if not, at least just try chicken, because I like chicken a little better than I do fish.
That's fine.
I like lobster and shrimp, but those they don't have the same thing.
Yeah.
Okay. Well, are there any other tips that you give cancer patients?
Eggs are also obviously a great source of protein as well, and are considered superfood. So if you like eggs, eating eggs is great too.
Okay. Any things you can think of to stay away from? I think that's
I think basically, look, if you're on chemo and you really want ice cream, go for ice cream. You don't stop yourself from eating certain things like completely. If you're like, oh man, I'm really craving that. If you're craving that and like that's the only thing that seems appetizing to you, then eat it. But in general, as we say with anyone, for a healthy diet, try and kind of limit the amount of red meat for sure. Ultra processed foods, fast food that you would buy, food that you buy in a box and heat up in the microwave, try to avoid that. Basically trying to go for foods that come as a fruit or a vegetable or a piece of protein, as opposed to something that comes in a box that you heat up.
And then the carbohydrates and starches, just make sure they're complex if I can.
Yep, exactly.
Okay. Well, I really appreciate everything. Is there anything else you can think of or that you want to?
I just think that, when it comes to whatever you're experiencing during chemo, so let's say you're experiencing nausea, obviously trying to get that under control to help you, be on the way with your diet. If you're experiencing, like I said, just loss of appetite, speak about that with your physician to maybe get on a medication to stimulate your appetite. But if you're having like continuous nausea and vomiting, diarrhea, all these kinds of things, you really need to get those checked out to see if it's a side effect of the chemo or if there's an obstruction or, what exactly is going on. So I think it's really important just to keep track of the symptoms that you're going through and being in constant contact with your oncologist, your oncology team, to be sure that you're optimizing your diet and minimizing your side effects.
So percentage, and this will be my final question. Percentage-wise, now let's go to micronutrients or macronutrients first. What percentage do you think we got our fat, carbohydrates, and proteins? What percentage?
So I would say, like, if you're looking at a plate of food, half of that plate should be fruits and vegetables. So if you're thinking about like fats and what would be in those mainly is probably the most that would be there is carbohydrates. One quarter of your plate should be your lean protein and 1/4 of your plate should be a complex carb. So, I guess in terms of like fats, I guess it differs like from patient to patient, because like a lot of times they say you should not be eating a high fat diet because it kind of is harder on your stomach, especially during chemo times. So it varies, but I think the plate analogy is actually the best. It's like looking at your plate, 1/2 should be vegetables and fruits, 1/4 lean protein, 1/4 complex carbs.
Okay. All right. Well, I appreciate everything. I look forward to having talks with you in the future.
Yeah, definitely. I'm happy to discuss further with you as well.
Okay. Well, good luck, and I appreciate everything.
All right. Thanks. Good luck with everything.
Thanks.